He had been complaining of his foot for 4 or 5 days, and he's not our complainer. So, after he had made the comment, he just came home one day after track and he's like, my foot is just killing me. So my husband and I decided, okay, it's time to figure out what's going on. So we got a hold of Corinne.
When I saw Cole initially, the coach had sent him in from practice. It was one of the days that I was scheduled to be out at the school, and he came into the athletic training room and told me that his foot had been bothering him for a period of time and it just wasn't getting any better.
We went to Corinne because we have some other friends that have had injury within the school system, and they were very satisfied in how she reacted right away and how she was able to get them the treatment that they felt was best for their child. And so we just went to Corinne right away. Plus, we really didn't know what doctor that would be able to help him the best. And we just felt like if we went to her first, she could kind of give us some direction in where she felt we should take him and where he could get the best care.
In Cole's case, it was important for him to let the athletic trainer know what was going on. Initially, they tried treatment that they felt would get him better, and when he was not, she was quick to get him into our office.
At that time, I was able to have his dad schedule an appointment with Dr. Rayborn the next morning.
Dr. Rayborn saw him, ordered an x-ray. The x-ray came back inconclusive, so they went ahead and ordered an MRI.
There were several indications that just didn't sit right, even though the x-ray was normal. That worried me that there still could possibly be a stress fracture there. It's not uncommon for there to be an early stress fracture that's not seen on an x-ray, so often further imaging, especially if there's a high clinical suspicion, needs to be done, or else that can progress and become a worse injury. The last thing we would want would be for Cole to continue to run on a foot that had a fracture in it, then make it worse, have it crack through further, and it'd be a much lengthier recovery for him and possibly even need surgical correction.
That was one thing that we were very appreciative of with Dr. Rayborn. Once he found out that the x-ray was inconclusive, instead of making us wait and come back the next day or the following day, he did whatever he could do to make sure that we were able to get that MRI done the same day.
He was seen in the office and then got an MRI later that afternoon, and then subsequently had the results the next day of what was going on.
The MRI was positive. We ended up placing him in a cam walking boot in order to decrease the pressure on his foot to allow that to heal. Had he continued running on it or even walking on it, it would have taken a lot longer to get better. It speeds recovery. It is designed to take the pressure off of the foot and the fracture.
The athlete and the parent did not want to make an extra trip down to the office, so I offered to bring Cole a walking boot out to the school, and I was able to fit him out at practice with a walking boot.
When Corinne had called us and said that he needed to get into the boot, we were like, She's like, don't worry. She goes, I'll make sure, he gets to Russia. I'll make sure that it's fit right. And at that point, it wasn't so much that we knew we weren't going to be able to get back to get him to see Dr. Rayborn or see Corinne. Our concern was, how do we know whether if he just comes home with this boot, if we're going to be able, if we have it on right?
As an athletic trainer, we are trained with applying braces and putting braces on, instructing athletes how to properly fit them and things like that. So it was something that I was very familiar with. I had actually worked with Dr. Rayborn in his office doing this for his patients years ago when he first started, and so it was, again, something that I felt pretty comfortable doing.
I think that she just has the type of personality that, when you see her work with our athletes on and off the court, You can just tell that she truly loves what she does, and she truly cares about the athlete. And I think, for us, to me, that means a lot, that, even though it's not her son, that she did whatever she was going to do to get him healthy, and to make him better and stronger than what he was before the injury. When we went for that 4-week appointment, I kind of knew that he probably wasn't going to get out of it. So we went for the appointment, and Dr. Rayborn said, nope, you need to be in it for another 2 weeks.
Had Cole continued running, he definitely could have had worsening injury. It could have cracked through the bone and possibly required surgery to fix had it not healed properly.
I was very appreciative of him, not at that 4-week mark, just saying, nope, go ahead, you're good. He really made sure that he was completely healed before he cleared him to return to his sport.
When he said 4 weeks wasn't enough, my heart just kind of dropped because I was looking forward to getting back into track and all the events. But I also realized that it was best for me so that way it wouldn't reoccur and come back again next year.
Our first primary goal with athletes in any injury is that they can safely return to their sport.
When he vaulted, of course, I kind of stood there with my holding my breath, thinking, "Oh, please, don't let anything happen." But he was fine, and he hasn't had any problems with that foot since then.
And I was not worried about my foot coming back because I felt like I was in great hands with Dr. Rayborn.
As sports medicine physicians, we're not necessarily making them better athletes. I think the coaches and the training and the athletes themselves do that. We're there to make sure they're doing that safely. We're there to make sure they can try to stay on the field and do the activities that they really want to do.
If anyone was to get hurt, she's going to jump right up. She's going to give us parents advice on what we need to do. So I think that it's very, very important that she continues to be there and that Premier Health continues to support and having those athletic trainers within the schools.
Sports are only going to be there for your high school and maybe college careers, but health is going to be there for your whole life.